we will not be able to see all the sinuses with this view. So in this aspect, we can able to see sphenoidal sinus and frontal sinus. So sphenoidal sinus, it drains into the superior meatus, and frontal sinus, it drains into the middle meatus. Is it clear till now? Okay. Now you see a small opening here, right? This is the pharyngotympanic tube. Pharyngotympanic tube or Eustachian canal. Okay, what is this? Basically, the middle ear drains ear. Okay, so basically the middle ear opens ear. So any kind of rhinitis will obviously result in sinusitis because it drains into the nasal cavity. Or any kind of infection your sinus has will obviously can result in rhinitis. Okay, any ear infection can result in sinusitis or rhinitis. Okay, fine. Now moving on to the next view or next aspect. Okay, so this is the frontal view, that is the lateral wall of the nose, and this is we are going to look about the front view like this. Okay, so in the front aspect, I can see the ethmoid sinus, and this is a very important sinus, the maxillary sinus. Okay, so this will be the inferior concave, this will be the middle concave, this will be the superior concave, middle concave, and inferior concave. If I reflect the concave, there will be meatus. Okay, so the maxillary sinus is one of the largest paranasal sinuses, and it is about 15 ml in volume. At birth, it might be around 6 ml, but in adolescence, the volume of the maxillary sinus will be 15 ml. And it is lined by pseudo-stratified ciliated columnar epithelium of 0.8 mm thickness, which is nothing but Schneiderian membrane. Okay, so what is the significance of this membrane? Any kind of pathology, it might be thickened. Any kind of maxillary sinus lift procedures, we have to assess the thickness of this membrane and then we have to perform the procedure accordingly. Okay, the maxillary sinus, it drains into the middle meatus. The maxillary sinus is of clinical significance because it pneumatizes over age. What do you mean by pneumatization? Pneumatization means, say for example, if it is at adolescence, say for example, if the maxillary sinus is around 0.8 mm or 1 mm from the apices of the roots, but over a period of time, when we age, the sinus pneumatizes, or when a tooth get extracted, when we remove the tooth, the sinus will get pneumatized. It will come down, the sinus lining will come down, and that will pose some kind of clinical complications, as in case of extraction, or when we do a sinus lift procedure, when we place an implant, or when you want to do bone augmentation procedures. Okay, so over a period of time, the sinus pneumatizes. Okay, the ethmoidal sinus, it drains into the superior and middle meatus. Okay, so the ethmoidal sinus drains into the superior and middle meatus. So this will be the basics of the nasal cavity. We talked about the lateral wall and a few sinuses. So we'll be giving notes as of how much the distance will be of each roots to the antral floor. So sometimes those questions will be very difficult to answer. So if you can able to master that, you can move forward some 1000 ranks easily. Okay, so those you can see in the notes, and this will be the very basics, and in the future we'll talk about other anatomical aspects. Thank you so much for watching the video. Have a great day.